Good afternoon. My name is Erin Fleckenstein, and my partner Martina Tokars and I will be presenting our systematic review, Sugammadex versus Neostigmine and preventing post-op nausea, vomiting, and bariatric surgery. This doctoral scholarly project was completed in December 2025. Bariatric patients are at high risk for post-operative nausea, vomiting, or PONV, with rates reaching up to 70%. PONV delays recovery and hospital discharge and reduces patient satisfaction. Neostigmine has traditionally been used as a reversal agent for neuromuscular blockade, but is associated with increased PONV and respiratory effects. Sugammadex, a newer agent, is thought to reduce these risks and align more closely with enhanced recovery protocols. The Enhanced Recovery After Surgery, or ERAS, protocols aim to minimize surgical stress and optimize recovery. Literature shows that rapid reversal of neuromuscular blockade is crucial for meeting ERAS goals. Multiple studies suggest Sugammadex improves outcomes like time to extubation and PACU discharge. However, findings related to PONV have been mixed, and its specific use in bariatric populations needs further evaluation. The primary problem is the rate of PONV being high in bariatric surgery patients, which can prolong recovery and increase healthcare costs. Our objective was to conduct a systematic review comparing the effects of Sugammadex and Neostigmine on PONV in adults undergoing bariatric procedures. We included peer-reviewed studies from 2014 to 2024 involving adult patients undergoing bariatric surgery. Studies had to compare Sugammadex with Neostigmine and report on PONV outcomes. Only primary research articles were included, as there were no reviews or editorials. Databases searched include CINAHL, Cochrane, ProQuest, and others. Search terms were built around the PICO framework, including bariatric surgery, Sugammadex, Neostigmine, and PONV. Filters applied included adults, peer-reviewed studies, and a 10-year publication window. Using the PRISMA method, we screened 164 articles. After removing duplicates and applying inclusion and exclusion criteria, 4 studies were retained for full review. These were the most relevant to our clinical question. The final review included 3 randomized controlled trials and 1 cohort study, conducted in China, Turkey, the UK, and Canada. Tools for assessing PONV included visual analog scales, the Apfel score, and clinical observation.
3 studies for Theme 1 by Agenton Moby, Akinci, and Johnson. Ding's study supports Sugammadex benefit, but the remaining studies do not show. Strengths of the review include the inclusion of recent peer-reviewed RCT. We recommend conducting larger-scale randomized controlled trials with standardized dosing. At present, there is not enough evidence to favor one reversal agent over the other solely. To improve future research quality, studies should apply consistent PONV